Should I start?
Just a minute, ma'am. Yes, ma'am.
Good evening, everyone. Myself, Dr. Aanchal. And as we have started the exam mastery type classes in which we do rapid revision of all the important topics, volatile facts through quick revision discussed here, and highly topics of all the subjects we covered. And also we discuss most affected topics which are important for all the university exams. So in today's class, we're going to discuss blood and immunity. And in long questions, we're going to discuss about plasma proteins along with their cytosynthesis and its function. Then we're going to know about the hypoproteinemia, erythropoiesis. Then in short question answers, we're going to discuss about the blood volume and principle of its measurement. Then we'll discuss about colloidal osmotic pressure. Then we're going to know about the PCV and ESR. And in the last, we're going to discuss about the type of anemia which occurs due to vitamin B12 deficiency. So in Oracle, we provide core feature. Core feature includes live classes for the elevated learning of the students. Then we also provide recorded sessions so that the student can have the access of all the subjects anytime, anywhere through the recorded sessions. And also we provide notes that are CBME based question answers, MCQs, and full zone for self-assessments. And also we do provide MCQs which are from beginner level to expert level, which contain standard multiple choice questions. Then in Oracle, we provide subscription plans starting from basic to mentorship plan. So basic plan is of 3 months, standard plan is of 6 months, and mentorship plan is of 12 months. In mentorship plan, it costs around 50,000, and the services includes like pre-recorded classes, live class, live doubt clarification, one-to-one personalized guidance, notes, quick revision examination module, and also for instant 20% discount, you can use my code that is Dr. Aanchal 20. So we're going to start with today's important topic. So first we have that how much is blood volume and how is kept constant and the principle of its measurement that we're going to discuss. So we know that blood consists of plasma and cell and the blood volume is normally around 5 liter, right? So we know that blood is the circulating in the blood vessel, and blood does its duty of transferring nutrients, supply of oxygen to the tissue throughout the body. So the normal volume, that is
హలో సార్ ఈ ఆన్సర్ మేడం లాగౌట్ అయ్యారు మళ్ళా ఒక్క నిమిషం మళ్ళీ వచ్చారు సడన్గా క్లాస్ ఆఫ్ అయిపోయింది ఒక్క నిమిషం చూస్తాను చేశాను బిజీ వచ్చింది ఒక్క నిమిషం కనుక్కుందాం ఒక్క నిమిషం
Sorry for the interruption. Actually, there was a electricity cut over here.
ఓకే ఓకే సో మ్యామ్ డూ వాంట్ టు స్టార్ట్ క్లాస్ రిస్టార్ట్ క్లాస్ మ్యామ్ ఆర్ కంటిన్యూ
Should I start? So normally the blood volume, that is very, very essential. That is 5 to 6 liter. Now next we have that how we do measurement of body fluids. Okay. So for measurement, we know that total body water and the volume of different compartment of the fluids are measured by a technique that is known as indicator dilution method. And the another name for this is dye dilution method. Indicator dilution method. Okay. So for this also we have a principle that what happened in this, a known quantity of substance such as a dye. Okay. So that will be administered into a specific body fluid compartment, and these substances are known as marker substances or indicator, right? So now what happened after the administration into the fluid compartment, the substance is allowed to mix throughout with the fluid, and then a sample of fluid is drawn and the concentration of the marker substances is determined. Now here radioactive substances or other substances whose concentration can be determined by using the calorimeter are generally used as a marker substances. So to determine the blood volume by using this method, we have a formula, and that formula is V is equals to M upon C. Now what is V here? V is volume of fluid in the compartment M is mass or total quantity of marker substances injected, and C is concentration of marker substances in the sample fluid. Okay. So by using this formula, we can easily determine the volume of fluid that is present in the compartment. Okay. Now, one more thing is there, a correction factor, that some amount of marker substances is lost due to excretion through urine during distribution. Okay. So to determine that also we have a formula. So for correction factor, we have a formula, that is V is equals to volume is equals to M minus amount of substance excreted upon C. Okay. So this is the correct factor. So this indicator dilution or dye dilution method is used to determine the ECF volume, plasma volume, and the volume of total body water. Okay. Now, another question we have is determine the plasma proteins along with its site of synthesis and list the important function of plasma protein and their normal serum level, define hypoproteinemia, and discuss its clinical significance. So we know that we have three types of main protein: albumin, globulin, and fibrinogen. Already their concentration is given. Albumin is 35 to 50 gram per deciliter. Then this fibrinogen is 2 to 4. Then it should be DL. right? And this globulin, we have alpha 1, alpha 2, beta, and gamma. So now talking about their site of synthesis. So cytosynthesis, all the plasma protein gets synthesized in liver except the gamma globulin. Why not gamma globulin? Because gamma globulin is known as the immunoglobulin, and that is formed by the reticuloendothelial system. Okay. Now, another thing, that what are the main function of plasma protein? So all the function of plasma protein are very, very important, and that we're going to discuss. So first we have the role of plasma protein in coagulation. So both fibrinogen and prothrombin play a very important role in the process of coagulation. Then second, we have role in defense mechanism of body. So gamma globulin play a very important role in the defense mechanism of the body by acting as antibodies, and these proteins are known as immunoglobulin. Then next we have role in transport mechanism. So we know that plasma protein are very essential for the transport of various substances in the blood, and albumin and alpha globulin and beta globulin are responsible for the transportation of major hormones and enzymes, right? Then another function we have the role in maintenance of oncotic pressure in blood. So we know that at capillary level, most of the substances are exchanged between the blood and tissue. So because of their large size, plasma protein cannot pass through the capillary membrane and easily remain in the blood. So in blood, these proteins exert the osmotic or colloidal osmotic pressure. Then next we have the role in regulation of acid-base balance. So plasma protein, particularly the albumin, play an important role in regulating the acid-base balance in the blood, and because of the virtue of their buffering action, plasma protein are responsible for about 50% for maintaining 50% of the buffering capacity of blood. Then next we have the role in viscosity of blood. So plasma protein provide viscosity to the blood, which is an important factor to maintain the blood pressure. And here the protein which is responsible for maintaining viscosity, that is albumin. Then next we have role in suspension of RBC. So during circulation, the RBC remains suspended uniformly inside the blood. So the property of the red blood cells is known as suspension stability. And here, which two protein are responsible for maintaining this? That is globulin and fibrinogen. Then next we have role as reserve protein. So during fasting condition, when the person is not taking adequate amount of food, so that time the protein become the source of source of energy, and the plasma protein are utilized by the body by the body's tissue as the last source of energy, right? So plasma protein are split into amino acids by the tissue macrophages, and amino acids are taken back by blood and distributed throughout the body to form cellular protein molecules, right? So next, already we have discussed plasma protein, cytosynthesis, important function, normal serum level we have covered. Now the hyperproteinemia and clinical significance. So what is hypoproteinemia? So hypo means less and proteinemia is due to deficiency. So hypoproteinemia refers to deficiency or decreased level of the plasma protein level, right? So hypoproteinemia is a condition in which the person has low protein level inside the blood, and it can occur if a person does not eat enough or certain it's not having a proper certain health condition. Okay, so proteinemia is uncommon in developed condition where most of the people eat a balanced diet, right? Now, if we talk about the symptoms of this condition, so the symptoms are very common. Like obviously, due to deficiency, weakness will be there, brittle nails will be there, then hair thinning, okay, stress, fractures. Okay, these are the very common symptoms, right? Now, what causes this hypoproteinemia? So, health condition that affect the digestion or the absorption or the use of protein from the food can causes this condition. Okay. Now, if we talk about the thing that can happen, so that could be due to prolonged starvation, that is physiological cause. Then it can occurs due to renal disease like nephrosis, because large amount of albumin get lost through the urine. Then in liver disease, it also occurs due to liver disease because of the hepatic synthesis of plasma protein that will get depressed. And also the hyperproteinemia can occur due to malabsorption, in which there will be decreased absorption of amino acid inside the intestine. Okay, so all these conditions are there in hypoproteinemia. Then next we have what is colloidal osmotic pressure and what is its significance. So this is also the star mark question, and usually this question is being repeated in every alternate year in the university exam. Okay, so osmotic pressure across the capillary wall can be exerted by some crystalloids like urea, sodium, glucose, and also by some colloids like plasma protein. Okay. Now, the capillary wall is completely permeable to the crystalloids. This is completely permeable to crystalloids, right? So, crystalloids hardly contribute to capillary osmotic pressure, and protein exert an osmotic pressure of about 25 mm Hg. Okay. Now, if we talk about colloidal osmotic pressure, that is COP. So, this is inversely proportional to the molecular size, shape, and this is directly related to the concentration of molecule. Okay, so 80% of colloidal osmotic pressure occurs due to presence of a protein, that is albumin. So albumin here uh, act as a major factor. Okay, so colloidal osmotic pressure across the capillary wall is used to maintain the exchange of fluid at tissue level, and the rate of fluid tissue at any point along a capillary depend upon the Starling forces. Okay, so we have to discuss about the main Starling force. So first, like we have hydrostatic force or pressure across capillary. This favors the filtration. Means filtration will be promoted by this pressure, right? Like in case of GFR. Then another we have colloidal osmotic pressure across capillary wall. across capillary wall. So this favors absorption. Then third we have hydrostatic pressure. In interstitial fluid. This is normal 2 to 3 mmHg, right? And last we have the interstitial fluid osmotic pressure, that is also normal 3 to 4 mmHg. Okay. So, as we already talk about the hyperproteinemia means decrease in plasma protein level. That can also cause the decrease in colloidal osmotic pressure. So, whenever increased filtration occurring at arterial end and decrease in absorption of fluid occurs at venous end, that will result in abnormal collection of fluid in interstitial spaces, and that condition is known as edema, right? Now, next we have the another very important question, that is erythropoiesis. Okay, so erythropoiesis already we know. Erythro means RBC and poiesis means the red blood cells formation, right? So that erythropoiesis we going to discuss in adults as well as in intrauterine life, right? In fetal life. So first of all, what is erythropoiesis? Erythropoiesis means the process of origin, development, and maturation of RBC. And if we talk about the hemopoiesis means development of all the blood cells, right? So first we're going to discuss about the intrauterine life, okay? So in intrauterine life, we have fetal life, we have mesoblastic stage, hepatic stage, and one more is there, that is myeloid stage. Okay, first stage is mesoblastic, second is hepatic, and third is myeloid. So, mesoblastic stage means what happens during first trimester, means during 1 to 3 or 2 months of the intrauterine life. So here the RBCs are going to produce from mesenchyme of yolk sac. Then in hepatic stage, that from third month to 6 months, it occurs inside the liver mainly, and also in spleen and some lymphoid organs. Then in myeloid means from 7 to 9 months of intrauterine life, the development of RBC occurs inside bone marrow. Okay, so this is all about the intrauterine life. The synthesis of RBC occurs in yolk sac, from mesenchyme of yolk sac in first trimester, in second trimester in spleen and liver, and in myeloid stage, the third trimester, the development occurs in the bone marrow. Now coming back to the adult life. So already we have discussed that in adult life we have the common myeloid progenitor, then in proerythroblast, then basophilic erythroblast, polychromatic erythroblast, orthochromatic erythroblast, that is also known as normoblast, and prochromatic erythroblast. So one by one we're going to discuss them in detail. Okay. So first stage, as we have discussed, we have proerythroblast. Next we have early normoblast. Then we have intermediate normoblast. Then late normoblast. Then reticulocyte. And finally matured RBC. So the main is the size of cell is going to decrease with every stage. Okay, like the diameter in proerythroblast is 20 mu, so it will get decreased to 7.4 mu in the matured RBC, right? Then size of nucleus is also decreased with every stage, and it disappeared in late normoblast. Disappeared. Then in intermediate normoblast, there will be appearance of hemoglobin occurs, right? And the important thing that the nuclei get disappeared in early normoblast. So these are the main events that occurs, and the size of the cytoplasm will increase with every stage. Okay, so these all are the stages of erythropoiesis in adult life. Right? Fine. Now next we have the factors that are necessary for influencing the erythropoiesis, that also we're going to discuss. So we have first the stimulating factors. So first we have stimulating factor. So for stimulating factor, first we have hypoxia. So already know what is hypoxia. Hypoxia means reduced ability of oxygen to the tissue, right? And this is the important stimulating factor for erythropoiesis, and it stimulates erythropoiesis by inducing the secretion of erythropoietin from kidney. Okay, so whenever hypoxia occurs, means decrease PO2 to tissues that will stimulate kidney will produce erythropoietin, and erythropoietin will stimulate bone marrow to produce RBC. Right? So next we have the maturation factors. So in maturation factors, we have vitamins. Okay, vitamin like vitamin B3, vitamin B6, vitamin C, vitamin D, vitamin E. They all are responsible for the maturation of the art. Okay, then next we have the intrinsic factor of Castle. So this intrinsic factor of Castle is very important for the absorption of vitamin B12. Important for vitamin B12. Now, how this intrinsic factor of Castle is relevant to the process of erythropoiesis? Because first, this intrinsic factor of Castle is secreted by the parietal cells that are present in stomach. Second, this important for vitamin B12 absorption, because this vitamin B12 is very, very necessary for the process of erythropoiesis, or for the necessary for the maturation of RBC. Right? Then last we have folic acid. Now this folic acid is also essential for RBC maturation, and it is required for the synthesis of DNA, and in the absence of folic acid, the synthesis of DNA will decrease, failure of maturation, and this leads to a type of anemia also, that is known as megaloblastic anemia. Okay, So that's all for the erythropoiesis. Now next we have the another topic, that is PCV, means packed cell volume. Okay, so we need to about PCV. We're going to discuss that how it get determined, and also we're going to discuss about its significance, right? So PCV, what? By PCV is the portion of volume that is acquired by RBC, and always this PCV is expressed in the form of percentage, right? So this PCV is the volume of RBC packed at the bottom of hemoglobin, means SCT, right? So for determining this, we have a method of determination. What happened in this method? In this method, what happened? Blood is mixed with the anticoagulant, and that anticoagulant we use is, that is EDTA, or heparin also we use. So that filled in hemocritic or Winthrop tube, right? Then the tube with the blood is centrifuged at a speed of around 3000 revolution or 3000 RMP for 30 minutes we do. Right? So that tube with the blood is centrifuged at a speed of 3000 RMP, and the RBC packed at the bottom form the packed cell volume, and the plasma remain above. As we can see, here we have the RBC, then buffy coat, then the plasma. In the picture we can see, right? So in between the RBC and the plasma, there is a puffy coat, as we can see, which is formed by the white blood cells and the platelets, right? So the RBC at the bottom, that form the PCB volume, and the plasma remain above. So this is how, by using this method, we can easily determine the PCB, right? Now next we have, what is its significance? So the significance we have, first, in the diagnosis and treatment of anemia. Second, in the diagnosis and treatment of polycythemia. Third, in the determination of extent of dehydration, and in the last, the decision of blood transfusion. Okay, so these are the main significance of this PCB, right? Now, next we have, what is ESR, and also we're going to know about its clinical factor affecting and its clinical significance. So what is ESR? ESR is the rate at which erythrocytes get settled down, right? So ESR is erythrosedimentation rate. So this is the rate at which RBC settle down, right? So normally the RBC remains suspended uniformly in circulation. This is known as suspension stability of RBC. And if the blood is mixed with an anticoagulant and allowed to stand on a vertical tube, then the RBC settle down due to gravity with a supernatant layer of clear plasma. Okay. So for determination of ESR, we use Westergen method and Winthrop method, right? Now, another thing, that what are the factors that are responsible for affecting? So that factors affecting ESR are, we have specific gravity, of RBC. So whenever there is increase in specific gravity of RBC, there will be increase in ESR, and this occurs because of specific gravity increases the weight of RBC. So the settling down of RBC is faster, so the ESR will increase. Then next we have Rayleigh formation. So Rayleigh formation will always increases the ESR. This is because after piling up the RBC over one another, right? So what will happen? Piling up the RBCs become more heavier. So this will make the settle down of RBC easier. The next we have decrease in number of RBC. So decrease in number of RBC will increases ESR, and this occurs because RBC being more in number normally, so it maintains the viscosity of blood. When the RBC number decreases, the viscosity of blood is also decreasing, so making the settling of RBC more faster. Then next we have increase in size of RBC, right? So increase in size of RBC increases ESR. This is because increased size of RBC make it more heavier, so that the settle down of RBC become more faster. Okay, so these are all the factors that are responsible for affecting the ESR, right? Another thing we have, that what is its clinical significance? Why this is very important? Okay, so the clinical significance, like this is important in determination of various conditions like allergy condition, sickle cell anemia, peptone shock, polycythemia. Okay, so we're going to know about the pathological variations. So ESR increases in the case like tuberculosis, then malignant tumor, liver disease, and ESR decreases in the case like allergic condition, polycythemia, then sickle cell anemia. Okay, so that is all for ESR. Now next we have the another thing, that is explain why vitamin B12 causes anemia and give the picture in this condition of blood. So the vitamin B12, as we have discussed, is important for the maturation for RBC. And if vitamin B12 deficiency will occur, so in that case, pernicious anemia or adhesions anemia will occur. Okay. So in this case, pernicious anemia, or the another name is adhesions. Adhesions anemia occurs, right? So pernicious anemia is the anemia due to deficiency of vitamin B12, and as we have discussed, this is also known as adhesions anemia. This is occurs due to atrophy of gastric mucosa. So what is the cause? This occurs due to atrophy of gastric mucosa that occurs because of autoimmune disease. Okay, and this autoimmune disease occurs due to destruction of parietal cells. Okay, so what will happen? The gastric atrophy results in the production of decreased production of intrinsic factor, and there will be poor absorption of vitamin B12, because intrinsic factor is there, that is essential for the absorption of vitamin B12. So if vitamin B12 will be not be there, vitamin B12 deficiency will not be happen, and there will be no maturation of RBC. So the RBC become immature. So they become more larger as compared to matured. Okay. So in this case, what will happen? It will lead to macrocytic and hypochromic RBC. Okay, so this type of pernicious anemia, it is very common. It is very commonly found in old age, and also it is very common in females and then in males, and as it is also associated with other autoimmune disease like disorder of thyroid gland, Addison's disease, and the characteristic feature of this type of anemia, that lemon yellow color of skin. Okay, so that's all for today's class. So already we have discussed all the questions. So we have covered plasma proteins, then normal level hypoproteinemia, erythropoiesis we have covered, blood volume determination, colloidal osmotic pressure, fat cell volume, ESR, and vitamin B12 deficiency. So that's all for today's class. Thank you so much for watching my class. I hope you find this class more helpful. For any kind of questions, query,